Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now let's look at the appearance of amyloid. The first method will be on light microscopy and the standard HND. So the appearance includes the amorphous eosinophilic extracellular substance. Amorphous eosinophilic extracellular substance. So the other method includes the Congo red stain and or the ordinary light. So the appearance is pink or red in color and tissue deposits. Then comes the Congo red in case of polarizing microscope. So polarizing microscope, how does it look? So this is nothing but the apple green appearance is seen. So apple green birefringence. Then we move on to the fluorescent. So fluorescent stains. Fluorescent stains, there's a thioflavin, that is a T and the S. Thioflavin, T and S. So the appearance in case of the fluorescent stains, the thioflavin T and S, their appearance is yellow color under the UV light. So it's yellow color under the UV light. Now when we move on to the polarizing, it was apple green, that's a Congo red. Now in the electron microscopy, that is the electron microscopy, there is a non-branching fibrils of indefinite length and a diameter of approximately 7.5. So there's a diameter of 7.5 to 10 nanometers. So non-branching fibrils and indefinite length and a diameter of approximately 7.5 to 10 mm. Now let's move on to the X-ray. So there is X-ray crystallography and the infrared spectroscopy. So here the characteristic cross the beta pleated sheet conformation. So they cross the beta pleated sheet conformation. To learn and grow daily like this, please do subscribe.